Welcome to Thursday's edition of COVID-19. The alarming uptick continues here in Korea, with daily cases standing at 700 today. And we take a closer look at this trend later on with our panel of experts. We begin now with the broader pandemic coverage with our Kwon So-ah. So do start us off with the local situation then.
Sunny, for the first time in 3 months, Korea recorded daily infections in the 700s. 700, to be exact, is the number that we're seeing as of 12 a.m. this Thursday, which includes 674 domestic transmissions and 26 cases from abroad, so a rise in both of these. And with that, Korea has a total of 107,598 infections, and with 2 additional fatalities, the death toll stands at 1,758. So let's take a look at this graph now. In the past 3 days, we went from 478 to 668, and now we are at 700. So we are clearly seeing a shift here since the beginning of April. And that is why the average in daily domestic transmissions has now risen to 543. Recently, we've been seeing numbers between the 300 and 400s for many weeks, so this is a clear rise in cases. And the situation is especially looking grim in the capital region, with both Seoul and Gyeonggi-do province now having over 200 infections. And there are also concerns down here in Busan with over 50 cases, also Daejeon 25. These 2 places have also enhanced their level of social distancing measures just recently. And speaking of which, on Friday, the government is to announce which social distancing level is going to be applied beginning next week, with a chance of stronger measures now more likely. And a quick look at the vaccination front now. We have over 35,000 people who received their first shot yesterday, and more than 9,200 who received their second shot. And we will have more on the vaccination front with our Ji-young in a bit.
Right, so and further fueling the need for speedy vaccinations are here is the growing presence of variants here.
Right, Sunny. Recently, we've been seeing an increase in variant cases being transmitted locally, and citing the situation in some European countries as well as the U.S., Prime Minister Chung Se-kyun said that it's those variants that could trigger a 4th wave of the virus.
With 330 variant cases confirmed so far, Korea is not a safe zone. If highly contagious variants spread across the country, they could add even more fuel to the flames.
Now, speaking of variants, the UK variant is now the dominant strain of the coronavirus in the US, which has now over 31.6 million infections. And India is dealing with a double mutant. Now here, India had some 126,000 cases in the past 24 hours, while Brazil saw over 4,000 fatalities in just a day. And another Latin American country here that's having concerns is Argentina, with 2.4 million cases, which recorded its highest ever number of daily infections on Tuesday as well as on Wednesday, with over 20,000 cases. And with that, the total number of infections around the world stands at 133.6 million. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. Back on the local front, the rollout of AstraZeneca vaccines for those under 60 has been halted at the moment here in Korea as authorities look into a 3rd case of blood clotting. I have Ji-young in the studio with details on that. Welcome, Ji-young.
Hi, Sunny.
Right then, Ji-young, do start with the KDCA's latest decision regarding AstraZeneca's vaccines.
Sure. The KDCA announced on Wednesday that it would pause its inoculation of AstraZeneca vaccine for those aged under 60. This applies both to people have received their first dose and those yet to receive it. Also, vaccines for special education and daycare center instructors, as well as school infirmary workers and daycare center nurses are postponed as well. The agency said the decision was made with safe precautions in mind after the country's 3rd case of post-inoculation blood clots was reported in an AstraZeneca vaccine recipient. According to the government, a woman in her 20s suffered blood clots in her legs after getting AstraZeca's shot. The vaccine was administered on March 17th, and the symptoms occurred after 12 days on the 29th. Health authorities said an expert panel will be deliberating on the matter following an announcement by the European Medicines Agency on its probe into the possible link between AstraZeneca vaccines and post-inoculation blood clots.
Right, and speaking of the European drug regulator, it has announced a clear link between AstraZeneca vaccines and very rare cases of blood clots, right, Chiang?
That is right. After an investigation, they concluded that there is a possibility of very rare blood clots combined with low levels of blood platelets, which can occur within 2 weeks of vaccination. But the agency was not able to establish which demographic groups were especially vulnerable to such conditions. Take a listen.
Most of the cases occurred in individuals below 60 years of age and in women. But because of the different ways the vaccine is being used in the different countries, the committee did not conclude that age and gender were clear risk factors for these very rare side effects.
The EMA continued to stress, however, that the overall benefits of getting vaccinated outweigh the risk of side effects. It remains to be seen if the EMA announcement will allay the fears going around in Europe, with many countries like Germany and France having suspended the use of AstraZeneca shots for certain age groups. Even the UK, the home of the biotech giant, is considering an alternative vaccine for those under the age of 30 amid the still lingering concerns over AstraZeneca shots. South Korean Prime Minister Chung Se-kyun, meanwhile, urged local health authorities to thoroughly review the results and promptly draw a scientific conclusion.
Right, and staying with that, Korea's drug regulator has approved the use of Janssen's COVID-19 vaccine, right, Chiang?
That's right. A panel of local experts ruled that the vaccine developed by Janssen, a subsidiary of Johnson & Johnson, is safe and effective. Following the recommendation, the Food and Drug Safety Ministry said on Wednesday that it has given its final approval.
The final review committee examined the results of the Ministry of Food and Drug Safety's evaluation and also that of the 2 previous meetings by an expert panel. The committee recommended the approval of Janssen's product under the condition that the company discloses its final clinical trial report.
The panel concluded that the vaccine is safe and that only mild symptoms like muscle pain and headaches were seen after the vaccination, with the test group recovering from those side effects within 2 to 3 days. Also, the efficacy rate of the vaccine was found to be at 66.9% after 14 days of inoculation. This is the 3rd COVID-19 vaccine that has been approved in South Korea, and unlike AstraZeneca and Pfizer shots, Janssen's product is a single-shot vaccine.
The vaccine has been designed to prevent COVID-19 in adults aged 18 and older, is administered in single doses of 0.5 milliliters, and can be stored for up to 24 months in temperatures between -25 and -15 degrees Celsius.
The government has signed a deal with Janssen to secure up to 6 million bottles, and they are expected to be administered in the 3rd quarter of this year.
I see. All right, Chiang, as always, thank you very much for that update.
Thank you for having me.
Right, up next, we're poised to join the regular briefing on the COVID-19 situation here on the local front for this Thursday. Now, authorities have reiterated calls for COVID-19 testings among those who believe they may have been exposed to the virus as part of efforts to stem cluster infections. Also, failure to abide by entry logs at dining and drinking establishments can result in fines of up to 100,000 won for patrons and 3 million won for owners. Similarly, those who violate the no eating guideline are poised to face fines again of 100,000 won. Remember, the consumption of food and beverages is only allowed at places of dining and drinking, including restaurants, cafes, and bars. In other words, eating is banned at all other venues such as movie theatres, sports stadiums, cram schools, churches, and so forth. We are still waiting for the briefing to commence, so let's take a look at Korea's social distancing guidelines in place until the 11th of April. The briefing, I hear, has started. We'll come back to you afterwards.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for April 8th, Thursday. As of today midnight, we have 674 new local infections and 26 new imported cases. The total caseload now stands at 107,598. And we had more than 82,368 people getting tested yesterday. And at the makeshift testing centers in the metropolitan area, we carried out 36,114 tests, confirming 114 patients. And we have 432 more people making full recovery, while we still have 7,480 people still remaining in quarantine. There are 112 patients with critical or severe conditions, and we had 2 additional fatalities, with the death toll now standing at 1,758. I extend my deepest condolences to the deceased and the members of the bereaved families. We are seeing cluster infections across the country, and we would like to ask you to refer to the press kit for detailed information. And we will be focusing on the metropolitan area and also the antibody testings, the analysis that has been done on the new military trainees. First of all, in the general residents in the metropolitan area, we focused on Seoul, Gyeonggi-do province, and Incheon. So among the general residents, we looked at those people starting from the January 13th and also March, and we selected about 5,002 people of those who have went to health clinics, and we have seen tested their antibodies, and a total of 26 people had developed antibody against COVID-19. To this end, we see the ratio now stands at 0.052%, and the public national survey conducted last year, compared to this figure, we have seen a slight increase in the ratio of antibodies. And we have been discussing with our panel of experts as for the reasons, and we have seen the second and third wave of the COVID-19 outbreak being the major cause of such an increase. And some experts also say that in the metropolitan area in particular, most of the people share their common lifestyles, and also they have limited boundaries. And compared to the Gyeonggi-do province, we have seen, compared to Seoul City, we have seen Gyeonggi-do province, which has been a higher antibody development among these residents, calling for more attentions and more notifications among those residents. And starting from the December and November of last year and until early this year, we have been looking at about 15,000 new service members in the military, and we have seen a total of 21 people who have tested to have developed these antibodies. And starting from September and also November last year, in relation to this similar analysis, we do not have a significant implication with the new analysis. However, we have seen that in the young generation, we need to ask these people to continue to comply stringently with the quarantine measures going forward. And this antibody analysis that we have carried out recently, we can see that our general nationwide antibody development rate is significantly lower than other countries like the US or Europe. However, we are at a critical point of a possible fourth wave, and before we have and reach our herd immunity, this is very significant, and we need to also comply stringently with the basic quarantine measures like wearing a face mask and social distancing. And the quarantine authorities would also like to note that we will be analyzing and assessing these figures going forward, and the antibody testings will be carried out going forward as well on a regular basis. And we will be focusing on regions that see major large outbreaks, and we will see that after the vaccinations, we will see how many people developed the antibodies, and we will be carrying out these analyses and assessments and we will also disclose the details in a transparent manner. And here are our details for the treatment of COVID-19. As for remdesivir, we have administered the drug to over 5,610 patients here in South Korea. And as for the Retinora treatment, we have administered the drug to a total of 1,209 patients here in South Korea. And as for life quarantine measures, that is, we have the safety e-report being run by the Safety Ministry. Here are some examples and latest reports of the breaches of quarantine measures. We have seen at basement floor locations, which are the pubs and clubs. We have also had the special crackdown that is being carried out by the Seoul Metropolitan Government. And as for the breaches, we have seen that some of these facilities opened all night long, having back doors, and also people did not wear face masks. And also there were dance groups where people danced together and also joined for drinking and eating together as well. And as for these nightlife entertainment venues, we would like to mention that there are many risks of COVID-19 infections, especially considering the unspecific people who are visiting these people, and the non-compliance to the visitor log is also another risk factor at these facilities. And these facilities need to designate a quarantine manager, and they also need to have a strict entry log for all of the visitors, and also ban anyone who has symptoms of COVID-19. And all of the visitors are asked to wear face masks at all times, and they need to keep 2 meters of distance with others, and such basic quarantine protocol is to be abided by at these facilities. And as for these measures, please note that you will be subject to stern legal measures if there are any breaches, and we will be having stern measures that will be also being subject to these breaches of quarantine measures. And as for the status on COVID-19 vaccination here in South Korea, as of April 8th midnight, a total number of COVID-19 first dose recipients numbers at 1,075,574, while the number of second dose recipients stands at 42,647. And in the first queue, we have seen that the first dose recipients, the target group, stands at about 87%. And by the facilities, we have seen about 91% care facilities, and about 84% of the first responders, and about 89% of the general hospitals have completed the COVID-19 vaccinations. And as for COVID-19 treatment hospitals, 95.3% have completed first dose of the inoculations, and about 62% have been completed with the second dose inoculation. And of the Q2 eligible recipients, we have seen about 7.4% of our vaccination rate. And we have been carrying out our vaccinations for the seniors aged above the age of 75, and their vaccination stands at about 2.5%. And as for the elderly residents and workers at care facilities, their vaccination rate stands at about 14%. And especially the people, the residents and the users above the age of 65, we have seen the 64% of the vaccination rate, and also all of the nursing hospitals, and the residents and the workers, their vaccination rate stands at about 40%. And we have 94 new cases of adverse responses being reported after inoculation, and a total of 11,309 have been reported so far, and a majority of them were mild and common symptoms, including muscle pain, headache, and fever. We have 111 suspected cases of anaphylaxis with one additional case, and 21 cases, suspected cases of severe cases with one additional case, and 2 additional cases have been, death have been reported, with the total number standing at 40. Moreover, in relation to the inoculation, we have been reviewing the safety of the AstraZeneca vaccines, and and here are some details. According to the European Medicines Agency, they have said that on the 7th of April, they said that they have seen some correlation between the AstraZeneca vaccine and the rare cases of blood clots. And their results say that the benefits of getting vaccinated outweighs the risks of side effects, and they also confirmed that they will go further and proceed with the AstraZeneca vaccine rollout. And in relation to this, we will be also revealing the details, and we will be looking at the global trend, a related trend as well, and we will be looking at any side effects that are reported here in South Korea, and we will also have regular meetings with our experts. And as of now, we believe that by weekend this week, we will be able to roll out a timeline for our AstraZeneca vaccine program timeline. And we will be highlighting and putting priority on the scientific evidence when we disclose details of the safety of the AstraZeneca vaccines. We will be opening our ears to all of the panel of experts in all circles, and we will be coming to a decision which is safe based on the scientific evidence and proof. Last but not least, we have a message to the public. As seen in today's statistics, we see that we are seeing a major resurgence of the virus, and all of these indices are becoming worse right now here in South Korea. Starting from this year, we have seen our daily tally hovering around 400, 500, and 600, and also 700 today, and this is increasing day by day. Nevertheless, thanks to the perseverance put forth by the citizens and also the efficacies of the quarantine measures put forth by the health authorities are also being effective and proved to be effective to a large extent. We are seeing a large increase in the number of new cases. However, we see a lower number of fatalities and also a lower number of people with critical or severe conditions. And also looking at the antibody development analysis that we have disclosed to you today, we are seeing that they do not go in the opposite direction compared to the expectations of our experts. And also we have seen, we would believe that with a tailored and a specific targeted quarantine measures for specific clusters and also facilities, we have been able to contain the virus to a large extent. This means also that we can cooperate with the public to contain the virus going forward. And we will be basing on scientific proof and evidence. We will be coming up with more systematic quarantine protocols. We will also exert our full efforts to provide and devise more quarantine measures going forward. Of course, we have large challenges going ahead. We have a high number of daily tally. We also have a high rate of the reproduction rate, and we also have the risks being posed by the influx of new variants and the local spread of new variants as well. And amid such local transmissions, we believe that we need to continue to carry out quarantine measures and intensify our social distancing measures going forward. As mentioned, all of the indices are worsening. Nevertheless, we need to also speed up our inoculation. This is also a major task that the government has at hand. However, as mentioned, we need to come up with wise measures, and also we need to ask the public to continue to participate in these measures. And thanks to your support, we have been able to contain the virus spread to a large extent. And once again, we ask for your support, and we ask for you to exert your perseverance going forward. And we have been able to maintain to the status quo thanks to your participation and your perseverance. It is not only us, the South Koreans, who are fighting against the COVID-19. However, the entire international global community is fighting against the pandemic. We are seeing a resurgence of the virus in other corners of the world as well. This means that all of the other nations need to intensify their social distancing measures. This is something that is common globally. And with the solidarity and unity put forth by the Korean citizens, we need to go back to the basics in terms of our quarantine COVID-19 measures. We need to wear our face mask properly and keep social distancing measures. We need to refrain from having private social gatherings if they are unnecessary. And if you do not feel well, please visit a screening clinic nearby and get tested as soon as possible. And also have credibility and trust in the vaccination. And we believe that you might have some concerns and nervousness against the vaccines. However, we pledge that we will be communicating in a transparent manner. Thank you.
기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Kwon Junuk with Thursday's afternoon briefing. So what did he have to say?
Well, Kwon started with the results of a study on COVID-19 antibodies. Residents in the metropolitan region that went to medical facilities, out of 5,002 people, 26 had developed antibodies for COVID-19. He said that is a slight rise from the year before. And the same was conducted on people in the military, or to be exact, people newly enlisted for the military. And out of more than 10,200 people, 21 had antibodies, so that's 0.08%, not that significant, but here in the metropolitan region it was 0.52%. But compared to countries in Europe and the US, that is lower, Kwon mentioned. And also he said the situation is currently worsening, with numbers having recently been in the 400s, now jumping even to 700. But he did say that if we have targeted measures, prevention measures at the places of high risk, there are chances to overcome the current situation.
All right, Swa, thank you for that.
See you tomorrow.
Right, up next, we bring you efforts aimed at making eco-friendly face masks to address the dire environmental challenges posed by the disposal of our current face coverings. Do take a look.
The world's plastic pollution crisis, driven by the heavy use of face masks, is threatening our planet's animal life and the natural environment. At a time when masks have become an indispensable part of our everyday lives, is there no other alternative? To address these concerns, Korean researchers have developed an eco-friendly biodegradable mask filter that can be used dozens of times and offer a similar level of protection as KF94 certified masks.
천연 비료에 우리 마스크 필터를 넣었더니 풍부한 미생물에 의해 28일 이내에 완전히 분해되었습니다.
This was made possible through the use of nanofibers made out of biodegradable plastic.
키토사 나노 위스커가 자석으로 볼 때 양의 정국을 갖고 있다라고 보시면 됩니다. 그러니까 그것들이 코팅이 돼 있으니까 미세 입자가 들어올 때 음의 정국을 갖고 있으니까 그게 자석처럼 쭉 끌려 들어오게끔 붙잡아주는 그런 원리를 가지고서 마스크를 만들었다고 보시면 됩니다.
The research involved in the making of these mask filters graced the March 17th cover of Advanced Science, a renowned scientific journal.
아직까지 개발을 조금 더 해야 되는 부분은 마스크 같은 경우 귀에 보면은 이렇게 탄성이 있는 이렇게 조금 늘어나는 소재들이 석유계 플라스틱을 아직까지 만들고 있고 코에는 알루미늄을 지지대로 쓰고 있지 않습니까? 근데 모든 소재들을 다 생분해성으로 바꾼 다음에 쓰시고 매립시켜서 쓸 때는 100% 다 분해될 수 있게끔 만들려고 연구 중에 있습니다.
Another local firm has developed a durable face mask made out of copper that can be reused up to 150 times. Research has shown that copper surfaces can inactivate the SARS-CoV-2 virus in just 4 hours.
저희 회사는 2017년부터 구리에 대한 항균력에 굉장히 관심이 많았고요. 구리의 항균력을 원단으로 가공해서 다양한 생활 잡화에 적용을 하면 좋겠다고 생각했습니다.
When washed by hand, the copper face mask can be reused up to 150 times, with one mask being usable for up to 5 months, even if it's worn daily.
분말이라던가 코팅을 통해서 구리 원단을 만들기 때문에 세탁 후에는 그 기능을 소멸하게 되거나 떨어져 나갈 수가 있는데요. 저희 같은 경우에는 구리 원산에 구리 이온이 결합된 형태여서 그 기능이 저하되지 않는 것이 큰 특징입니다.
The mask has also earned KF-AD certification from the Ministry of Food and Drug Safety for its ability to block respiratory droplets.
저희는 3중의 기능성 원단을 가지고 중간 레이어에 바깥쪽에서 들어오는 비말과 안쪽에서 나갈 수 있는 비말 등을 모두 차단할 수 있게 되었습니다.
Other innovative products are also being rolled out, like nanofilter masks, biodegradable masks made from corn fiber, and mask filters that are naturally sterilized when exposed to sunlight. Korean researchers and mask manufacturers are teaming up to develop new masks that are more eco-friendly and offer more functions than ever before. New certification standards will also need to be established to assess the safety of the new materials and the reusability of these masks. It is hoped that future technological advances will lead to a widespread adoption of eco-friendly face masks designed to protect human lives and Mother Nature at the same time.
좀 더 상황을 지켜봐야 하겠으나 4차 유행이 본격화되는 가능성이 차츰 커지고 있습니다.
앞으로는 전국의 모든 보건소에서 거리두기 단계나 증상과 관계없이 누구라도 무료로 진단검사를 받으실 수 있도록 무료 검사를 확대하겠습니다.
Korea's daily tally has surged to alarming levels this week, reflecting a global uptick in COVID-19 infections amid challenges on the vaccination front. Now, for more on this, I have Dr. Yoo Byung-wook from Suncheon University Hospital. Welcome back, Dr. Yoo. And I also have Professor Lee Hoon-sang from Yonsei University. Good to have you with us, Professor Lee.
Thank you for having me.
Right then, Dr. Yoo, keeping in mind the fact that daily infections hit above 600 on Wednesday and exactly 700 on this Thursday, what are some of the major risk factors that Korea faces at this moment?
From the beginning, people are afraid about COVID-19 because it's very new. The problem is the people they are used to, they believe that COVID is kind of nothing, just kind of cold, and they get used to already. That's why people doesn't afraid anymore. Some of still they are afraid about the COVID-19, but especially for the young group of people that thought COVID-19 nothing. What is different? So we are get used to. That's why they are start to register having test. Also they have some rumor about the vaccination. So it's not only the phenomenon in Korea. Many people in Europe and north part of the United States, they believe that COVID-19 is kind of pattern and the phenomenon is now, which means people are get used to. They're not afraid anymore. It's a number of get used 500. It's my personal opinion that people not afraid anymore COVID-19. This is a major factor that can be spreading in now in Korea.
Right. And another concern, Professor Lee, is the reality that the cases are not just taking place here in the metropolitan region. The cases outside of the metropolitan region account for about 40% of the daily total. How do you explain this worrying trend?
So I think before the cases had been congregated in the Seoul and Gyeonggi province, where there is much more larger populations and the population density is higher. But I think as the COVID-19 pandemic continues on, the sustained social distancing measure is giving a lot of stress, a lot of pressure to the people. And right now, many of the infection and spread are happening in a very small gathering, in small family gathering, and in small company environments, where it is just difficult to keep some kind of social distancing and physical barriers. So I think it is just becoming more and more difficult to keep a very high level of the strict distancing measure.
Right, and against that backdrop, Dr. Yu, some pundits are forecasting the daily cases could hit 1,000 in the near future if authorities fail to rein in this latest surge. Do you share this outlook?
Well, I agree on part of this. Professor Chung from the Gachon University, he had the planning of the statistics measure. He told us a couple of months before, it can be hit. The late of March and early of April is coming up to 1,000 to 2,000 cases confirmed because of the statistics matter. But first time, I disagree that, but we haven't had an experience like deja vu. It happened December last year. It was around the 500 struggling and jump up 700, it jumped up to 1,000, 1,200 rapidly. But that time we have a measure of social distancing, no more than 5% gathering. That helped to the cutting down. The problem is people who keep on this measure of social distancing too strictly. In the even government around this election day, the people are focused of the quarantine for about the election. That's why even living lives in quarantine measure is a little bit loosened. That's why I hope not, but it can be hit around the 1,000 from probably the early of next week can be. I hope not.
I see. And perhaps to deal with that reality, Prime Minister Chung Se-kyun has pledged to expand free COVID-19 testings, as seen in the video before our talk. What are your thoughts on this initiative?
I think in principle, providing free accessibility to the COVID-19 testing I think it is good. And I think for any of the people who have any kind of symptoms, getting the accessibility to the COVID-19 would be good. But still, on the other side, just increasing the number of tests would not be halting the spread of the pandemic. It will be also necessary to have also other aspect of work, such as quarantining and isolation of the patients, and strict contact tracing, and all those efforts have to go together. But in essence, also would be important is still keeping strict social distancing and strict personal hygiene measure will be still important as well.
Right. And Dr. Yu, perhaps as proof of what you said earlier about how people are not scared of COVID-19, we have had cases of people shunning screenings despite showing symptoms. What can be done to address this reality?
Well, the people not afraid about, at the same time, in the basic kind of human being basic instinct, we are really worried about the infections in the basic human beings. So there are two phases. We're not afraid about COVID-19 because the people said young people are nothing, just like the cold. So, but at the same time, they are afraid about the infection itself, also social stigma. So people are, and the confirmed cases, they should be moved on the at least 14 days isolated in something facility. They are worried about having to put a stigma in after the discourse. So how we can encourage about them? There are two ways I thought. First, like me, so every 2 weeks, because Seoul Metropolitan Government enforced the orders of all medical staff to the test. This is second one. It's a randomized test of COVID-19 in the certain group, like schoolboys, girls, and the teachers group, and some military service and official groups of the government service. Let's go to randomize without symptom. That time, if we catch some clue of the tracing, we can catch it up and cut down. This is, I can call, start of the fourth wave of the pandemic.
Right, so preemptive testing is very important.
Yes.
Right. Dr. Yu, tomorrow, that would be Friday, authorities will disclose their decision on the future course of social distancing here in Korea for the next 2 weeks. What are your prospects?
Well, last two times, the last 4 weeks, we haven't noticed about social distancing twice. The keeping on social distancing level 2.0 in Seoul, Gyeonggi province. But there are some change. Yes, they haven't noticed some change, but who remember? I don't think so. Because it's a minor detail thing they explained to us, even us, the expertise, we don't have any difference about that, how people can follow that. So this time, we need this kind of political decisions to turn around to back to good side from the beginning of the fourth wave of the pandemic. That's why we should keep, there are two options. First is the previous social distance measure here, going to 2.0 to 2.5 in the whole nation, not except to Seoul and Gyeonggi province. Because as you know, the Busan, they are following Korea, Seoul, Gyeonggi province now 2.0, something like that. Because if they are different here, you know, the balloon effect, the people move on and still go around. And the second option is we prepared due social distance measure of the 4 different tiers. So there are one point we can see how we can turn back to good from the third waves, because we have the more strong than third tiers of social distance, we can call no more than 5% of the gathering. So there are new social distance measure, they say no more than 2 persons in the fourth tiers, the social distance. So this is quite strong, and the people can be struggling about this. But if we have a situation to see the strictly, if we feel like a crisis, among the we are little bit short, relatively shortage of the vaccine, so government can be put the great decision to forward to turning around the good side.
Right.
But it's my personal opinion.
Right. Professor Lee, let's turn to vaccines now. Earlier in the program, our Om Ji-young mentioned the European Medicines Agency speaking about a clear link between AstraZeneca vaccines and very, very rare cases of blood clots. What are your thoughts on this?
Well, on this matter, I think EMA is on a little bit more cautious side. So I think the European Medical Agency, EMA, I think has recognized the fact that there had been some cases which seems to be having quite a high likelihood of association with AstraZeneca vaccines and CVST, the cerebrovenous sinus thrombosis. But the number is very low, about 169 cases out of 34 million vaccination cases. So, and what EMA had been saying was that even though there had been some number of cases, a limited number of cases of the CVST, still the benefit much more outweighs the risk of developing this thrombosis situation. So EMA has not been recommending to stop the AstraZeneca vaccination because, as I said, the benefit outweighs much more than the risk currently.
Right. And speaking about staying on the side of caution, as mentioned by Professor Lee, Doctor, your Korea has also temporarily halted the rollout of AstraZeneca vaccines for those aged 60 and below. What are your thoughts on this?
Since yesterday, Korean government recommend to the suspended, the hold at the moment, less than 60 years old. I haven't agree a part of this, but also I disagree over part of this. Why? First, usually Korean FDA, KFDA do a little bit slow and a little bit more cautious about we remember about more than 65 years old person, we are postponed a while until the Edinburgh University and Scotland's report. And I have a personal channel from the US, they will be waiting for the approval about AstraZeneca one soon, which means they have enough evidence more than 65 years person with AstraZeneca efficiency and safety. That's why we are being noticed, we started. But also we have a certain notice from Europeans, EMA, say there are big possibilities of the thrombus and the clots after the shot, especially younger people are. That's why at least 1 week or maximum 2 weeks, we can postpone until get the official notice from the EMA or fully authorities agencies. But my concern is people, probably even my parents, more than 70, they don't remember which kind of vaccination is available in Korea, but they definitely know the brand AstraZeneca. Because many media say AstraZeneca, bad thing. So after that, we show them to now it's safe. Who believe that? My little concern is AstraZeneca one, Janssen one, Moderna, Pfizer, I believe everything is good for now, year in 2021 for us. But if you do dealing about this too much, about the turn on the face, people can be upset and disagree having that. That's why Korean government should be showed clearly their posters about AstraZeneca one. So for a little more detail explaining, we are waiting for the safety matter to get more evidence, and then we are straightly go to the vaccination later. We have to keep the same word to the people who believe about that.
Right. There has been a lot of publicity about AstraZeneca's vaccine. All right, Dr. Yu, thank you very much for your thoughts. And Professor Lee, thank you very much for your insights today.
Thank you.
Right now, health authorities are underscoring the importance of testing as part of efforts to keep the virus under relative control. So do take care, and thank you for watching.